Okay, good afternoon. We're going to start the broadcast. This is the webinar that was advertised, Gateway to Global Aging Data, as a workshop featuring the Mexican Health and Aging Study, the MHAS. My name is Rebecca Wong, and I will be introducing the study for about 5 minutes. Then Alejandra Michaels Obregon will be giving a tour of the MHAS website for about 5 minutes. And then we'll go on to the main content of the presentation, which is the harmonized data. And Tristan Phillips from USC will provide examples using the MHAS and HRS, the Health and Retirement Study. Okay. So for those of you who are familiar with the MHAS, just bear with me for the first 5-10 minutes. You'll get a tour and introduction to the MHAS and the tour of the website. So the Mexican Health and Aging Study started way back in 1999. We started thinking about doing a prospective study, a longitudinal national study of aging in Mexico. So that's how it started. And it was a collaboration among multiple institutions, both in Mexico and the United States. We thought from the beginning that it should be a study that had content and protocols that were comparable to the Health and Retirement Study, which was already in place since 1992. And the blueprint that we use, really, it continues to be the HRS for the MHAS. I'm not going to spend a lot of time talking about the study per se. So for background and design, please see among several publications, but this is one of the recent ones in the International Journal of Epidemiology, where you can see the cohort profile of the MHAS. If you don't know, the International Journal of Epidemiology actually publishes cohort profiles of many of the studies that you want to probably compare with the MHAS. One of the features that is very similar to the HRS, or similar exactly, is that we select people age 50 and over, and we interview both the selected person and their spouse. So we recruit the spouse as well to be part of the study. From then on, prospectively, we followed both subjects. It doesn't matter whether they separate or divorce, or one dies, we continue to follow the other. And also comparable to the HRS is that we have a core interview, a proxy interview for those who cannot conduct the interview themselves because of health reasons, usually. And also there is a next of kin questionnaire for once one of the participants dies, then we interview one of the relatives or caregivers who can provide information about the last year of life of that person. So that's also very similar to the HRS. Very similar to the HRS, also the MHAS has similar content, but of course adapted to the Mexican context. It has socio-demographic characteristics, childhood conditions, economic and health. Multiple dimensions of health, the current health of the elderly, chronic diseases, infectious diseases, depressive symptoms, cognition, an assessment of cognitive functionality, and physical function. And it has a battery on family and friends, both children and parents of the selected person or the respondent, and the social networks that that person has. The individual migration experiences, in particular for Mexico, there's an emphasis on migration to the United States over the lifetime. Help given and received to and from children in particular, and help given to parents. Economic data, which is another feature of the HRS. The MHAS shares that with the HRS. We measure wealth, consumer durables in the household, healthcare expenditures, and income sources, and income of both the individuals in the couple. Work history and current employment as some of the characteristics of the dwelling where they live, and psychosocial, which has been a major emphasis in the recent years in the study of aging. Attitudes towards health, the economic status, the perceptions on the power to make decisions, the satisfaction with life, and the perception of how much family help they receive and give. In the more recent years, we also included aspects of personality such as conscientiousness. In particular, as I said, in the next of kin interview, there's emphasis on the last year of life of the person who died, and there's a module on widowhood, or the consequences of the loss of a spouse. Now I'm going to go quickly over the the history of the MHAS as a timeline. So we started in 2001 with a sample of about 15,000 interviews of people born 1951 or earlier, that is, they were 50 and over. And then there's a follow-up in 2003 for about 14,000 interviews. And then there's a gap between 2003 and 2012. We revived the cohort and we added a new sample of those born in 1952 to 62, so that in 2012, again, the sample is representative of those 50 and over in 2012. We interviewed about 18,000 subjects, and then in 2015, we followed up 3 years later and interviewed about 15,000 people. This population, this sample is representative of the private dwelling population, that it's age 50 in 2001 and in 2012, as I said. And it's representative of most of the population age 50 and over, since virtually no people live in collective dwellings in Mexico. One of the main features of the MHAS, which researchers should know, is that it offers unique research opportunities just because of the timing of the waves. And here I'm marking the 4 waves that have been completed, and that there were 2 major policy changes in the country. There was a healthcare reform that started around 2003, and that basically included introduced universal healthcare for older adults and the population in general. And there's also a financial crisis that hit Mexico in 2009, similar to the one that hit the United States in 2008. As you can see, the timing of those events and the timing of the waves makes it ideal to be able to study before and after effects on the same subjects, given that healthcare reform. In particular, healthcare reform, the population that had health insurance in 2003 was about 50%. By 2012, after the healthcare reform, it's about 85%. So the increase in healthcare coverage was substantial. Another feature that you need to know at this point is that we have now a large cohort of people who have died in the panel. So that in 2003, we had 546 who had died. By 2012, we found another 2,700 who had died. So for a cumulative of 3,200. By 2015, we found another 1,200 that had died. So the cumulative deaths is about 4,500, which makes it a very useful, analytically useful cohort to study mortality, given all the behavior and childhood conditions and life cycle conditions that we know about these people, and as well as their last year of life. Another feature that we wanted to highlight is just the subsamples that we have had in each of the waves. In addition to the full core interview, we have had subsamples. So in the first and second waves, we had a subsample of for anthropometric measures. These 2 subsamples served to assess the self-report and the quality of self-report of individuals, say that when they report their body weight or their height, and you measure them. You also measure the circumference and of their waist and hip and other measures in anthropometrics assessments. In the third wave in 2012, we took a subsample to measure anthropometrics, but also performance, a couple of performance measures, time walk and hand grip, and we took blood samples, that's intravenous blood samples for some aspects, and finger prick blood for other aspects. So all of this data is available already on the website. And then wave 4, which we just finished in 2015, took a subsample of around 2,000 people to go for an in-depth cognitive assessment as well as performance and anthropometrics. This last data is not available yet, but it should be soon. And this is basically the introduction that I wanted to give of the MHAS. And as Alejandra will provide now, it's an overview of our website. Did they hear me? We cannot hear Alejandra.
how you can hear me. Hi, so my name is Alejandra Michaels. I'm going to talk a little bit about our website. So we have a beautiful bilingual website that hosts the data and documentation of the project. I will give you a tour to describe some of the features that are relevant for this webinar. But I would like to invite you to navigate the website for more features we have designed to create a user-friendly website. So today I will only focus on the documentation and questionnaire tab, the data tab, and the publications tab. So before that, I would like just to mention that we also have a discussion forum. This is an open space for users. We invite all of our users to go there, post any questions. They can even share any variables they created or information they have. As you can see here on the right side of the website, we already have many questions. So most of the times users have a question, but it's actually a frequent asked question, and the answer is already there. So we always encourage users to go there first and find and look for the information they're looking for. So let's talk about the documentation and questionnaire section. So this tab is divided in two different sections. So we have documentation first and then questionnaire. The first column on this first section has the list of all the available documents. Then we have a second column with the language in which these documents are available. And the years, we already have them available too. So you can see, for example, for 2015 that some of them are coming soon, but you will see also that some of the files are only available for certain years, and others are available for multiple years. Like this last one, the MHAS file description. This is one that was created and has information for 2001, 2003, and 2012. All of these files have been created either by the fieldwork agency, by the MHAS team, or by a collaboration of MHAS and the fieldwork agency. But all of them are very useful for users, have a lot of information regarding the study design and results. I highly recommend that all our users download the MHAS file description. This file has a lot of information about not only the structure of the files, but also about the IDs, the individual and household IDs, and how to use them to merge files across and between ways. So for all of our users, either of the raw MHAS data or the harmonized data, I invite all of you to just go and download this and take a look at the information we have there. Another special documents that I would like to highlight from this section are the codebooks. So this is like a lot of work that we put in, and it's creating a codebook with all the information about all the variables that are included in the questionnaire. And important for our users is that we have an explanation of, we include like the summary statistics and the frequencies, but also an explanation of the skips. This is very important for all questions that most of the users have about missings that sometimes are not missings but just skips because of how the questions are designed. So this is about documentation. Going forward to the questionnaire. So you'll find here the full questionnaires for the direct interview, which is the core questionnaire. The one for proxy interviews, as Dr. Wong mentioned, in some cases, for health reasons, a subject cannot complete the interview. We find a proxy respondent, and this is the questionnaire that is used. And for disease respondents, we use this next of kin questionnaire here. Again, we invite everybody to use them because it has very illustrative and shows includes all the variables and shows how the structure of the questionnaire is. And in particular, very important is the comparison of variables across waves file. This is a really nice file to understand what was included across waves, and for example, which variables questions we're not asking anymore, or which ones are new and when we included them. So now, before going to data, I just would like to show you, I would like just to go really fast over this, but we also have a publications tab. This is really nice for users too, because they can search. This is a search engine, and this feature was designed to allow users to search for different projects that have used the MHAS data. As you can see, it's still loading some of the information, but you'll see here. The search can be performed by keywords, type of document, and or authors. So for example, for this, what we're talking about today, which is comparing the MHAS with the HRS, or using the data from the MHAS and the HRS, we can check how many documents or publications we have with cross-national comparison. Most of them are with the HRS, but some of them are also with other studies in Latin America and the Caribbean. So, for example, if I check cross-national comparison, you'll see that we have 24 different records. Most of them are journal articles, and other are dissertations, as you see here. As for some reason, this is not showing. This is what happens when you're giving a webinar. Keep going? Okay. So you can also, here in type of document, you have different types of documents. I'm just going to talk about them so you know. So we have journal publications. We also have dissertations. We have book chapters. See? Don't worry. I can do this very fast. Here. Now we have one that's working. And you can filter your search using type of document, and even if you want, just filter using the author one or the other. So that's regarding publications. Okay, I'm sorry, but is this here? Now it's working. Something happened with my internet, I'm pretty sure. So let's move to the data. So the data section has 3 different subsections: the raw data, the imputed and harmonized data, and the restricted use data. So let's talk about the raw data. So you'll see here that we'll list all the available data files we have. All of them are listed by section in the questionnaire. All of them are listed on the left column. And in the right, you'll see all the years that we have them available. Important here is that starting in 2012, we combine some of the sections. So here you see that the sections, some of these household level sections for the direct and proxy interviews were combined to facilitate the use of the data instead of having to merge these sections. Same thing was done for all these sections at the individual level. So now the user can only select, can select just one data file, and then they can download it. So here I just want to point that we have the data files in 3 different formats: SAS, SPSS, and Stata. You can either click to download directly here, or you can even filter your selection by format. All of these files are available to the public without any cost. However, only registered users can download these files. So if I would like to download this one, it's important that all the users register first or log in to be able to download them. So if I log in here, you'll see that the data starts downloading immediately without any issue here. I'm just going to move on to the restricted use data. This is a special section where we have information about the restricted use files. We have a short description of what we have available, and we also have a description of the process to request access to these restricted files. So if anyone is interested in using any of this, I invite you to just go here, navigate, and check the information we have about the description of this process. Now I would like just to move to this special data section, which is the one we want to hear about, and it's the harmonized data section. In the section where we have imputed and constructed, we also have the harmonized. The imputed and constructed data has been completed by the MHAS team, but the harmonized data, it's a work that we have been doing with the Gateway to Global Aging Data project, and we're very pleased to be able to share this with our users. It works in the same way than the other data. You only need just to check the box of the what you're interested in. So here you'll see the data filings data. This is because I selected data before. But you can also access this data creation code and the code book. So after just showing you this, I would like just to ask Tristan to continue and explain and talk a little bit more about what the harmonized MHAS data is.
Thank you, Alejandra. All right, well, I'm going to tell you a little bit about the harmonized MHAS, which we've created in collaboration with the MHAS team. And it's really modeled after the RAND version of the HRS data, the Health and Retirement Survey in the US, which is a very user-friendly version of the HRS data that the majority of research done that's produced using HRS data uses this RAND HRS version. So we wanted to kind of capitalize on the success and the user-friendliness of the RAND HRS, and we've created harmonized versions of many other studies, and one of those that we're very excited about is the harmonized MHAS. So it's created to provide MHAS variables which are harmonized to be comparable to other international health and retirement surveys. Currently, the harmonized MHAS incorporates the first 3 waves of MHAS, that's 2001, 2003, 2012. It includes a subset of survey data from the MHAS, which is most comparable across surveys and most frequently used for research. So it does not include everything that is asked in the MHAS. What is always included is the unique identifiers that are used in the MHAS. So if there's variables that you want to use from the MHAS in the original data, you can of course link those to the harmonized MHAS and use those in conjunction with each other, which is often the best way to use them together. The harmonized MHAS is structured in FAT format, and what that means is that every individual is one record, and then the different records for different waves are listed out using a variable name convention. And that variable naming convention is we label our variables something like R1 work, and that's whether the respondent in wave 1 is working. And then of course in wave 2, the same question that was asked in the follow-up wave would be labeled R2 work. Variables are defined as similarly as possible to the RAND HRS definition of the variable. This is across all the harmonized data sets, so it's very easy to find comparable and identically created variables in different data sets representing data in different countries. Variable names also indicate how similar to the RAND HRS version of the variable that variable is. So for instance, we have a variable in the harmonized MHAS called R1 LBRF underscore M, and that underscore M lets you know this is an MHAS specific variable. LBRF in this case stands for labor force. So this is a variable which records the labor force status of, of the respondent in wave 1 of the MHAS. But labor force is asked differently in the HRS, for instance, and in MHAS. So although we include that information because it's important for researchers, we change this variable name here to let you know that they don't have the same categories in these two variables. We also include spouse versions of most variables. So for instance, a variable called S2 work is whether the respondent spouse is currently working at wave 2. These are really helpful for studying things like family effects, so you don't have to do spouse matching yourself. And as Alejandro showed you, how to download the Harmonized MHAS codebook is available, which has complete documentation for everything that's included in the Harmonized MHAS. It includes an overview of how the variable was created, whether those questions change between any different years of the MHAS survey, how it's different from the HRS or other surveys, and then we also list all the original variables that were used to create that variable. And I'll also briefly point out we also provide this data creation code that was used to create the entire data set. It's a quite long piece of code, but it's helpful if you want to go in and see exactly what we did by looking at this data code. And of course, if you want to do something differently, you could use that data code and change things slightly for your own research. So briefly, I'll just mention what are the other currently available harmonized data files. So the RAND HRS, which is developed by the RAND Corporation, of course MHAS from Mexico. In England, we have the Harmonized ELSA. SHARE is a European survey. Corellis is a Costa Rican survey. CLOSA is a Korean survey. The Harmonized JSTAR for Japan, the Harmonized TILDA for Ireland, the Harmonized CHARLES for China, and the Harmonized LASSI, which currently just includes the pilot data for LASSI. So across all of these different countries, you can find comparable survey items and variables that are created and named consistently, which kind of brings us to my example. So we're going to be doing kind of a short example of cross-country analysis using the Harmonized MHAS and the RAND HRS. Hopefully you'll get an idea of some of the advantages of being able to have these user-friendly data sets. So our research question is, are there gender differences in cognition? And are these differences consistent across all age groups? And do we see the same pattern in Mexico as we do the US? And this is, here's a citation for the work that was done in looking at kind of exactly the same thing here in China. But of course, here we're looking at comparing the Mexico and the US. I'll briefly mention we're going to be doing this in Stata. If you're not familiar with Stata, it's a statistical analysis package like SAS or R or SPSS. You can follow along. I'll be showing it here on the screen. If you would like to download this data code yourself, it is available as a handout with this webinar. It's labeled Advanced MHAS Webinar.doc. So if you download that and you wanted to run it in Stata, you would just need to change the extension from .doc to .do, and that's a do file. That's a Stata program there. All right, so let's begin. So here are the steps we're going to go through. The first is we're going to identify relevant variables in the Harmonized MHAS and the RAND HRS, which we want to use for our research. We're going to create a pooled data set with variables from both harmonized data sets together in one. When I say pooled, some people say pooled or stacked, but we're going to have respondents from both of these surveys in the same data set. We're going to compare our variables. We're going to apply weights. And then we're going to analyze cognition across genders and ages for each country. So the cognitive measure that we're going to be using is called a temporal orientation measure. It's one aspect of cognition. And in particular, both the HRS and the MHAS ask the same set of date naming questions. So the question is, can you tell me which day is today? And then the respondent is asked to list the day, the month, and the year. So we're going to be using this to kind of gauge cognition. This is, of course, one very small measure of cognition. Both the HRS and the MHAS have lots of cognitive measures. But for this kind of simple analysis today, we're going to keep it simple and just use these three questions together as kind of one measure of temporal orientation. So now we want to identify relevant variables in the Harmonized MHAS. We're going to be looking at 2012. That's going to be our year of interest. That's MHAS Wave 3. So we need to find our measures of cognition, an identifier of gender, an age identifier, and an analysis weight. So there's a couple ways to do this, and one way I'm going to show you is the Harmonized MHAS codebook. So if you've downloaded the codebook, it would look like this. Here's the Harmonized MHAS documentation. We also include bookmarks, so we can scroll down here and we can look for the cognition section. So here's our cognition section, and then inside of cognition, we can select date naming or orientation. And we'll expand that a little bit there. All right, so you should be able to see there. So we have this variable was just asked in 2000 in the wave 2 and wave 3 of MHAS. The day variable is called R2 day or R3 day. The month variable is R2 or 3 MO, and the year variable is R2 2 or 3 YR. You can see some brief overview statistics there, as well as how these are coded. So these are coded. 0 is coded for an incorrect answer, and a 1 is for a correct answer. And then using the codebook, you can also find out more information exactly about how these were created. For instance, that the orientation questions were only asked after wave 2 of the 2003 wave of MHAS. All right, so we know what variables we want, so we could use this also to find, for instance, gender or our age variable. So once we have our age variables together and our analysis weight variable, the next thing we need to do is we need to find those similar variables for the RAND HRS. And I'm going to do this instead of using the codebook. We're going to use our website that we have at the Gateway to Global Aging Data. This website is available at g2aging.org. And we have a search feature called Concordance. So if you click on Concordance here on the left, we could then select that we're looking at the RAND HRS. We know we want to look at 2012. That's our year of interest. And we could say, I'd like a gender variable, an age variable, and a date naming variable. So I've got those variables selected that I want to use. And if we click search here, we're going to get the list of those variables. So we can see our gender variable is called RA gender. That's going to be the same in the HRS, in the RAND HRS, and in the Harmonized MHAS. We've got our age variables. You can see the RAND HRS provides age in a couple different formats, in months and years. And then if you scroll down, we've also got our same date naming variables. And you'll notice that they have exactly the same names, except that for 2012 of the HRS, that's the wave 11 of the HRS. So these variables are named R11. So that's one of the things that we're going to correct when we put them together in a pooled data set. So those are kind of two ways to find the variables you're looking for in harmonized data. So let's go back. So the first thing we're going to do is we're going to create a pooled data set with variables from both harmonized data sets. So the first thing we're going to do is we're going to pull in our variables from the Harmonized MHAS, and you could do this with a static command like use the variables that we've already identified using the HMHAS dataset. We're going to make a variable called country, and we're going to assign that 484, which is the 3-digit ISO code for Mexico, because we want to know, again, we're going to put observations from 2 different studies in the same data set, so we need to make sure we know which observations are coming from which study. So we're going to identify those observations we just pulled in as from the MHAS and representing Mexico. And then we're going to append, and what append does, it allows you to stack basically. So it's going to put observations all below your current observations. This is different than a merge, for instance, if you're familiar with merging data. So we're going to append using the RAND HRS data. We're going to identify those variables that you want to keep. And then we're also going to for those new people, we're going to give them a country identifier of 840, so if they were just appended. So let's jump over to Stata, and we will do this quickly. So there we go. We've got our 2 country identifiers. The next thing we're going to do is we're going to add labels to the country identifier so we can have a little bit nicer looking output. So 484 represents Mexico and 840 represents the USA. You can see here in our Stata window that when we tab this variable, we have over 21,000 respondents for Mexico and over 37,000 respondents from the HRS representing the US. One thing you'll notice, of course, is that these are really large numbers, but these include people who weren't necessarily interviewed only in 2012, and that's because these harmonized data sets include everyone who was ever interviewed at any wave. The next thing we'll do is we're going to create an orientation score variable. So I'm going to call this variable R2012 orient. And we're going to make it quite simply just by adding together our three variables. If you remember, our variables are coded as 0 and 1 for yes or no. So for instance, when we add these three variables together, our day naming, our month naming, and our year naming, you could get a 0 if you got them all wrong, or you get a 3 if you got them all right. And we'll account here for our differences in different wave numbers for the different surveys. If we look at what that looks like in Stata, we can see here we just kind of sum that variable. You can see that the median score is 3. Who got 3? The mean score is 2.5. It's a little bit less than getting them all correct. And you can see at the 25th percentile, people were getting 2 answers correct, and at the 75th, they were also getting 3 answers correct. And that's because 3 is that highest number there, and it ranges from 0 to 3. And then we also need to adjust for differing wave numbers in variable names. So we have 2 wave-specific variables that we're going to be using. One is our age variable, age in years, and our weight variable, our analysis weight variable. So just similarly like we did for our orient score, we're going to make this variable. So for instance, we're going to be using the variable R3 AGEY from MHAS and R11 AGEY underscore E for the HRS. To make this variable, we'll do the same thing with our analysis weight. And then we're going to create age categories. And age categories are sometimes helpful if you want to check differences between different age groups. So one thing that is important to note is that in the HRS, these questions are only asked to people at their first interview if they are younger than 65. So for the purposes of this analysis, we're going to limit the age categories that we're interested in to people who were 65 or older, just to make sure that we're getting a representative sample from both surveys. You could find out that information by using the RAIN HRS codebook, which would highlight for you that people younger than 65 were not asked this question if it was a follow-up interview. So we're going to have our age categories, so we'll have 4 age categories here. If we jump back into Stata, we can make our age categories. You can see they are 65 to 69, 70 to 74, 75 to 79, and then 80 and over. And you can see that we have a pretty good sample of more than 1,000 in each group for both countries, more than 2,000 actually, because the U.S. survey has slightly more respondents. And then we're going to apply weights. And this is something that people often ask questions about. So weights are different for different studies because, of course, they represent the different sampling designs of both surveys in different countries and how different countries are laid out. But you can analyze things together as long as you tell Stata that the weights are set up differently. And you can do that by specifying a strata. So we're going to set our P weight here to be the weight that we named here, our kind of a year-specific weight variable name, R2012 weight. We're going to set our country as our strata as country, that country variable that we created, identifying those respondents who were from MHAS or from HRS. And that's important so that Stata knows that these weights are specific to those 2 different regions in this case. Jumping back into Stata, if we tab through that, so we can see that we have 2 strata there while we look at it, and we can see the number of units and the number of observations in both of those. Okay, so let's actually start the analysis. Now we've got everything set up. So first, let's estimate mean cognition for each country. So one of the advantages of Stata and why it's frequently used by people using survey data is it has some nice built-in commands. And one of those we just saw, which is this svset command. So with this command, basically you can tell Stata what was the sampling design of this survey once, and then you can recall that for every additional estimate that you generate. So now that we've set svset here, we can then say svy comma, and what that tells Stata is, hey, remember how I set this the clustering or stratification or the weighting for this survey data. So we're going to tell it that with svy. We're going to include a subpop here because, again, we really only look at people that we have representative samples over both studies. So we're going to set a subpop here saying only consider people who are who have our age variable between 65 and 120 is just a max. There's no one who actually has 120 in either of these data. And we're going to conduct a mean. We're going to get a mean of our Orient score, and we're going to do that over country. So you can see some of the advantages of using Stata, and then there's a few commands to get this, which is quite nice. So you can see here, looking at Stata, so our mean score for Mexico is 2.23, and for the U.S. is 2.7. These are population estimates because we've adjusted with our weights. So that's nice. So it looks like on average in the U.S., we would predict that people are going to remember closer to all three answers here in Mexico. We can also look at this graphically, which is always helpful instead of looking at small results. So here is our two different scores from Mexico and the U.S. So this is mildly interesting. But of course, there is so much different between Mexico and the U.S., and one of those large things is English. So for instance, most of the HRS respondents take the survey in English. I think most, if not all, the respondents of MHAS take the survey in Spanish. So there's a lot of differences, some with language, some with culture, education systems. So while it might be somewhat interesting that people in the U.S. are somewhat closer on average to answering all three of these correct, it's not as meaningful and it's somewhat hard to interpret. So when most people do these cross-country analysis, instead of just looking at one difference between countries, we look at differences in differences. So for instance, and what we're going to look at is how is this difference, is there a difference between Mexico and age groups or gender that is different than the difference that we see in the U.S. between age groups and gender? And sometimes that's a more meaningful way to look at things. So let's do that next. So we're going to estimate mean cognition for each gender in each country. So again, we're going to recall basically exactly the same command as before. The only difference here is in our over option. Instead of just country, we're going to say country and gender. And what that tells Stata to do in the case of this command is going to create 4 groups. So it's going to create men in the U.S., females in the U.S., males in Mexico, and females in Mexico. So let's look at those results in Stata. So this is what these results look like in Stata. So we can say that males in Mexico on average are recalling 2.3% of these orientation questions, while females are recalling 2.1, so a little bit lower. And then it looks like comparing males and females in the U.S., males are at 2.7 and females are at 2.7 also, so they look actually quite close. If we look at this graphically, we can actually see that this is quite true. So it looks like there is a larger gap, at least in the estimates, for males and females. One of the other interesting things you'll notice here is that it is males in Mexico who have the higher of these two scores, higher average of these two scores, and females in the U.S. So again, this is kind of a difference in difference approach in that we're noticing a different pattern in Mexico than we are noticing in the U.S. So next, let's look over different age groups. So a lot of these cognitive scores, of course, are meant to kind of measure those things that happen to you at the end of life with memory, and then in some cases leading to dementia. So let's estimate the mean cognition for each group each age group in each country. So in this case, we can say SVY, and then we'll do the mean of our Orient score. You'll notice we don't set a subpopulation here, and that's because we've included our age category in our over condition. And that age category is only assigned for those people who meet our condition of being 65 or older. So we don't have to also subset our estimate by that because it's already done that. So if we jump back into Stata, you can see here we've got our 4 groups for the US and our 4 groups from Mexico. Of course, with 8 different estimates, it's much easier to look at this graphically. So if we look at this graphically, so you can notice a couple of things here. One is that you don't really see much of a decline at all in the US until our 80 and over age group, and then you see what looks like a significant decline. And in Mexico, you don't see really probably a significant decline until you get to 75 and over. So it could be that people in Mexico are experiencing a little earlier in life some of these temporal orientation deficits. And then you'll also notice, of course, how much that last category, that last age category in Mexico dropped. So it looks quite different. The gradients are quite different between the 2 countries, even though, of course, you still see Mexico a little bit lower in all the categories than the US in all the age categories. So we'll wrap this up by looking at mean cognition for each country, gender, and age group. So we're going to make, for each country, we'll have a country, age-specific, gender-specific estimate. So we'll do this, of course, quite simply by using our last command, but and adding RA gender into that command. So if we do this in Stata, you can see here we got our estimate. We have 16 different estimates now because we have 2 countries, 2 genders, and 4 age categories. And then we can also test the differences between these different age group categories. And you can do this using the test command in Stata. So for instance, if we test the difference between the youngest age group in Mexico, so between males and females who are youngest in Mexico, you would do this by saying testing subpopulation 1 versus subpop 5. You can see these are labeled here if you scroll up a little bit. So we can see that 1 is Mexico's males aged 65 to 69, and 5 is Mexico females aged 65 to 69. So let's look at that estimate. So it looks like, depending on how you want to count your significance, there's probably not a terribly significant difference for our youngest age group between males and females in Mexico. If we look at the same thing for our youngest age group in the US, it looks like, again, it's close, but depending on what kind of significance we're considering, there maybe isn't some significant difference for the youngest age group in the US. Looking at the oldest age group of Mexico, we do see a statistically significant difference there between our 2 age groups. And then looking at the oldest age group in the US, again, we probably aren't seeing much of a significant difference there between our 2 oldest age groups. And we'll just look at this graphically to kind of summarize everything that we've looked at today. So again, you can see kind of in our youngest age groups in both Mexico and in the US, we're not really seeing much of a gender difference. And the lack of gender difference kind of carries through all of our age groups in the US. But in Mexico, it really looks like this gender difference is really pronounced, especially for our oldest age group of 80 and over. So there are a lot of reasons that something like this could be true, and some of the power of using both the MHAS and the HRS is that they're longitudinal data. So we have data on these individuals, on some of these individuals. In the case of the HRS, going back to 1992, so you can get 14 years of data, of previous life data on them, and for Mexico, going back to 2001. So we could find out a lot about these people who are 65 and older. What was their midlife like? Of course, we could look at their education, what kind of education opportunities they had, what was their family life, what are their social interactions like, what was employment like, and all these things, of course, influence things like this kind of memory decline that we see, or a decline in temporal orientation that we see in late life. If you are using any of the harmonized data sets, including the harmonized MHAS, if you have any questions, we maintain a help desk, so you can always email us at help@g2aging.org. We always try to get back within about 24 hours. In some cases, that might be directing you back to the MHAS team, which is also incredibly helpful also. And I'd like to thank the whole MHAS team, and particularly Dr. Wong and Alejandra, for setting up this webinar with us today. And thank you all for joining us. I'll mention two things. There's a brief survey after you end this webinar, just asking you if you have any feedback. We'd appreciate if you would fill that out. And I think now you're welcome to ask any questions to either myself, to Dr. Wong, or to Alejandra.